So Kristina from Slainte, what problem does your business solve?
Slainte Finance was built from one simple truth, that on the top of your medical degree, an Irish GP doesn't need an accountancy degree as well. So what my husband and I have done, we've built an AI native, so AI first financial management platform for Irish GPs to really help them with the day-to-day management of their business is one thing, but also offering potential for growth and helping them to organize their finances. So a little bit what happens really is Irish practices are SMEs. They are small to medium businesses in themselves, but often when a GP qualifies, they don't necessarily receive much of the business or financial training, and here they start managing their business and they expect it to stay on top of the bills, of offices costs, of medical supplies, of staff costs and so on, and that starts accumulating, and it's extremely manual process to manage your finances for themselves, and even when they hire practice managers, often these people may not be necessarily financially trained. So Slainte Finance automates all of this for them and provides beautiful dashboards, amazing insights, really high quality reports, and it all takes 5 minutes versus hours.
Wow.
Otherwise.
So when you were putting this solution together, what was the hardest technical problem that you came across?
For us, and it came from the experience of my husband being an actual GP, is ensuring that the platform is extremely secure. Irish GPs are known for being quite conservative, and obviously when you're managing patients and healthcare data, you have to be extremely careful and safe. But that also translates into how they view the entire business. So having the finances safe was also the key. Therefore, our platform has two functionalities. It has a local-only mode. It doesn't live in a cloud. It lives on the laptop, and it is protected by whatever firewall and hardware they have. Of course, if they want to specifically access AI insights, and we have an amazing financial advisor, Finn, who helps them to optimize their business and to grow it, they can enable that access through the platform as well. And then there is an outreach to the outside of the platform.
Now you joined us today at Build Day in Dublin, and you came with a set of questions in your mind. And what have you really learnt today from the people you've met?
Yes, so far I've been here a couple of hours, and it's been an incredible experience from the amazing offices that welcome us so generously, to actually sitting beside my fellow peer entrepreneurs and learning from them. So, for example, I met Gavin Kirk, and I was sharing with him a little bit about how we launched just last week and how we're trying to get Irish practices to sign up to beta testers, and he was like, well, this is the hardest that you're gonna be experiencing, and this is what I've done, and that's what I recommend you don't take no for an answer, be fearless and go for it. So it was just really great feeling to get to hear from other entrepreneurs and understand that the challenges are normal, but you just have to keep going. So having that sense of the peer community, of being surrounded by like-minded, I'd say highly technical people as well, is an incredible experience for me. So I'm really grateful for being here.
So anybody watching this, where should they go to sign up for this service?
Yes, if you're an Irish GP, or if there is a GP in your network who's been really breaking their mind and trying to organize their finances, you can find us at slainte.app and sign up for our limited beta. We would love to learn from you on how we can improve our product.
Thanks for joining us today, Kristina, and showing us your solution. But let's have a quick look at exactly how this works.
Absolutely. So as a practice, once you sign up, you get an API key and you get an installation boarding instructions for the app. You install it, and you get a wonderful onboarding tour, and then you start, the first step is to really get your bank transactions. So as a business, you'd have a number. It works with both Bank of Ireland and AIB, so two main Irish banks. So you upload your transactions, and then a lot of the magic really happens in the background. So once Slainte Finance has the transactions, it categorizes them automatically. It gives them specific. It gives all your expenses specific categories, be it an office supply, your staff, and so on, and it pulls your main figures. So you can get your business overview in a matter of few minutes. You will know as a GP total income, total expenses, net profit, and your withholding tax. It's something that you definitely can get very easily at the moment. You have to go to your accountant. You may need to wait for weeks to get an insight in terms of how your business is running. What also it offers, it also GMS health checks. So that's one of the most time-consuming areas for GPs. This is categorization of HSC contracts that you have with the HSC provider, and not only points out how much you receive from the government for taking care of people, but also where there are gaps, how much more money you are owed, and it can assign you specific tasks. If you, for example, haven't claimed for maybe 100 under sixes that you've looked after, you're able to spot it really quickly, and you're able to contact the government and say, I'm missing out those payments from you. So it optimizes your business, it pinpoints the gap, and also from advanced insights, it helps you to grow it, because you can chat with your financial assistant, Finn, about any ideas or any possibilities that you have to expand services you provide as a GP. Or if you have a locum, which is a non-partner GP, if you want to bring it as a salary GP, you can ask Finn, what would be an impact if I hire this person and they stay with us for the next 5 to 10 years? What would be a bottom line impact on the business? So there was definitely more that can be done with the analysis insights, but this is just a short overview of what the platform would offer a small to medium business.
That's great. Well, thanks for sharing it with us.